Welcome to Live Talks by Dentsply Sirona, directly from the EAO 2019 in the exciting city of Lisbon, Portugal. We will send 5 live talks during the EAO, where you will have the opportunity to listen to interviews with experts and learn about the latest news and innovation in implant dentistry. My name is Mia Jensen, and I will guide you through live talks. With me today is Dr. Martin Wanendeya from United Kingdom, who has a special focus on implant and aesthetic dentistry, and is the co-owner of 3 implant practices in the area of London. A warm welcome to you, Dr. Wanendeya.
Thank you for the invitation, Mia.
It's great to have you here.
I'm really enjoying the city of Lisbon.
So digital implant dentistry and digital implant workflow seems to be the buzzwords within digital dentistry today, or within dentistry, I'd say. What does that mean to you, Martin?
The workflow, the digital workflow is a way when a patient walks into the practice, and it's everything that happens between the patient coming in, sitting in your chair, agreeing to go ahead with the treatment, to walking out with the final restoration, whether that's a crown or a bridge. It's everything that happens in between to actually achieve a seamless transition for your patient to get their tooth.
Yeah, and when you first started using digital technology, how did you find the process back then?
I think it's fair to say we did have a little bit of a learning curve in the practice. A few things that I remember was, for instance, if we would send impressions digitally, we used to writing lab dockets, so no lab docket would go and no one would know where the impression had gone. It took us a little while to understand how to use the scanner, how to go through the workflow on the computer and then the workflow within our practice. But we found that we adopted it fairly quickly, and now it's actually probably our preferred method of taking impressions and beginning treatment on patients is to do it digitally. So a little bit of a learning curve, but at the end of it all, we're really pleased with where we are.
Yeah. And one example of how a digital implant workflow has taken a major step is the newly released intraoral scanner, PrimeScan by Dentsply Sirona. Let's take a look.
I'm going to show you how easy it is to scan a patient with the PrimeScan and the Connect software. We're going to order a surgical guide from SimPlant. So my patient requires an implant on tooth position number 4-6, which I'm going to choose in the software. And then I go into the scan mode to scan the patient. Please open your mouth and we start scanning the situation. You see, this is already enough for a surgical guide, and we will send this file to SimPlant.
Thank you, Volker, for this demonstration. Martin, I know that you have a PrimeScan in your clinic, so what's your experience?
We recently got a PrimeScan, and what we found is it's faster and it's also a little bit easier for us to use in terms of the workflow and the touchpad and the computer to other scanners that are out there on the market. And as an example, I remember sending a case to my technician, Steve Campbell, and when I sent him the case, he immediately contacted me back to say how good the scan was, how accurate it was, how much he could see as opposed to the other scans that I'm sent him. The only thing that had changed is what we were using rather than our scan technique. And it's to the point now where I asked one of the nurses at the practice who does our scanning, Jessica, which one she preferred, and she much prefers the PrimeScan for the reasons that I've outlined. So we find that as a team and also from the lab technician, it's working really, really well for us.
Well, that sounds very positive, I'd say.
It is, yeah.
Another part that has improved a lot due to digitalization is really the possibilities for digital planning and guided surgery. So how do you work with digital planning in your practice?
In our practice, we like to, if possible, put the patient through a workflow where we carry out a CBC scan, we then get an intraoral scan, we then make an STL file, and we combine the DICOM and the STL data, along with a wax up that we've made of the final tooth position for the patient. Once we've got all this data together, we will then get a guide made, and sometimes based on that guide we're able to order components, which might be temporary or final abutments, and also temporary crowns based on that. So we like to put as much of that through the digital workflow as we can in the practice, and we find that actually it's more convenient for us and for patients.
And how do you work with your surgical guides? There are many ways to produce them today.
It's no secret that you can get surgical guides from different places, but what we find is that actually being able to send the guides out rather than print them in-house works far better for us, because as much as we could buy intraorals 3D printer, I don't think I have the time to start cleaning the models, curing the models, breaking them off. So I'd rather outsource that part of the production to either a manufacturer or a lab rather than do it myself.
Yeah, Dentsply Sirona recently extended the product portfolio with the SimPlant guide file, offering the possibility to actually print the guide in the practice. Let's see how this helps more dentists offer fully guided implant treatment to patients.
With Dentsply Sirona, we're fortunate to have guided surgery solutions for both the insourced and the outsourced workflow. The outsourced workflow with the SimPlant guide has great benefits such as the high quality, the time saving, and also the predictability and security of a fully guided implant treatment. But now there's also an exciting new opportunity for larger clinics, dental labs, to manufacture and print the surgical guides in the clinic. And we have our own guide sleeves for that. And with both these solutions, choosing your workflow, you have the same sleeve on drill components and the same surgical treatment protocol that can be used, which makes it really simple.
Thanks, Cassandra, for showing this. So does this look interesting for you?
It does. I've been a SimPlant user for many years, and one of the things that I think will really help other people who I know like the software, like the planning capabilities, like the ability to be able to, as well as place your abutments, place your implants, put the abutments onto your implants, and then design everything that you need. So by doing this, it opens it up to a lot more people, and I think this is something that we're going to use more frequently.
Finally, Martin, I would like to ask you, what are the main benefits for you and your colleagues and your team with going from analog to digital?
I'm glad you said the main, because there's many, I think, in terms of the benefits. But the main thing, I think, is the communication between us and the laboratory, and also we work in a team of specialists, so being able to communicate to other specialists, not forgetting the patient as well. Being able to show the patient on the screen with an intraoral scan what it is you're planning in their mouth, not another example, is really, really a powerful tool. So the communication is a massive thing. The other part that we found useful is being able to maintain the quality. So from when we scan the patient, being able to check the wax up all the way through. So what we deliver at the end is what we thought about and we promised at the beginning. There's also, I think, a convenience part of this. We've recently had a patient who lost a particular restoration, and because we had made everything digitally, we're able to get another one made for them very, very quickly and very, very easily without the patient having to come in to the practice. Yeah. So there's huge benefits in lots of ways. But I think patient comfort as well, I haven't touched upon. You know, everyone prefers to have an intraoral scan rather than an impression, especially when you're doing bigger implant impressions in the analog way. So for us, it's been, you know, a massive leap forward and also a big benefit. And the other thing I've forgotten is our team get excited. You know, for our team to get excited about this technology is really, really good. And for our patients to see that we've invested in the technology and also our team in order to provide them with the highest patient care, I think is something that is a real benefit.
That sounds very, very good. So with this, I would like to thank you, Martin, for taking the time to come here and share on your digital experience, and also what it has meant for you as a team and a clinic to go from analog to a digital life.
Okay, thanks for the invitation, Mia.
Thank you.
Okay.
So this was our live talks focused on the digital implant workflow. If you would like to watch this live talks again, check out the Dentsply Sirona Implants Facebook or YouTube pages. You can also share with a colleague or a friend. Here you can also find the inspiration talks, the satellite symposium from Dentsply Sirona Implants, addressing several different topics, such as the latest in implant innovations, single tooth treatment, fixed retention, and the digital implant workflow. And you will also be able to listen to my guest, Martin Wanendeya, lecturing there. So thank you for being with us, and welcome back.